You want to know your baby's position? Stick around. I'll show you everything you need to know and much more. Welcome to the Hypno-Baby channel. I'm Dr. Natalie Fizet. I'm a retired family doctor who delivered 3,700 babies. This is your channel, so don't forget to comment, like, share, subscribe, and be amazed. Of course, there's a big medical disclaimer. This channel is for entertainment only. You use it at your own risk. I am a doctor, but I'm not your doctor. Another funny story. I'm full of anecdotes. You see, there was a teacher in a teaching hospital, and there's like 20 students around him, and he goes, "Okay, this is how you turn a baby," and the patient's lying on her back. So he takes the patient's belly, and he's really confident. So he turns the baby, and sure enough, then he checks with ultrasound, and he goes, "Oh, now it's breech." Because the baby had turned. So first thing, they should always check before trying to doing the external cephalic version, because baby could have turned on its own. I've seen a baby turn during labor. It's possible, okay? So until it's born, you never know, especially, like I said, when it's not your first one, it can stay up until the very last push. So it's possible that a baby turns during labor. Very rare, though. Once they're down there, like the pelvis is like a bowling gutter, so usually they would stay in that position. So the gynecologist, after the students were like, "Oh," when they saw that now it was breech, he turned it again. The patient was was patient, and now the baby was head down. If you go through an external cephalic version, they take your breech baby and turn it around. We recommend, and it pleases the mind, but it's not even proven efficient, to walk after, to try to get the baby down and then do the ball and do like this light bouncing on the ball and everything. um, Turning the baby, doing the external cephalic version, doesn't cause labor. We do it at 36 weeks in case it would start labor, because then 95% of babies have their lung mature. It's they're 1 month before their due date. I think in my hospital, that gynecologist turned like she would turn one or two per week for 25 years. There's one patient that came back in labor. The rest, they just went to their full date. So there's it's not that common that it would induce labor. Have your Keep your suitcase in the car, but don't bring your suitcase saying, "Okay, then my labor is going to start." Okay, what is Leopold maneuver? It's from Christopher Leopold, again, 1800s. I don't know, everything in obstetric was done in the 1800s. I'm shaking my baby. This is the shaken baby syndrome here. So in 1800, he described, there's four phases. And again, I've seen some videos, they say, "Oh, we're going to know if the baby's chin up, chin down." No way. It's not that obvious. Like I said, even with the Leopold maneuver, a butt that's squeezed very tight feels like a head. Okay, I've done it. So the first thing, let's say now I'm the patient. So the doctor faces the patient, checks on the top of the abdomen. The baby's inside the belly here. So with two hands, we check to see if we feel anything round. That would be the hand. Or if we feel feet. Feet are usually like little round balls, and they're really mobile. So usually you can play with the feet. I'm sure you've seen that on your belly. Like feet are really mobile. Then we go the two hands. The second phase is the two hands on the side of the mummy. Again, we're trying to evaluate if the back is on one side, because it's there's less parts on the back. And it's not that obvious because I'm touching the baby right now, but imagine in the woman's belly, there's liquid, amniotic fluid. Some women have a lot, what they call a polyhydramnios, so there's a lot of fluid. Some women have more fat, so we're not directly on the baby. So all that thing about, like I said, the palpating the chin or the foot or everything, good luck with that. And the hand moves too, so it's harder to distinguish all this. But sometimes you can feel the back, like it moves less. And then the feet are usually more interactive. The turn maneuver is we go above the patient's pubic bone, and we put um, thumbs and index, and we kind of, it's like a grip. So we try to feel if we can feel you can imagine the baby's head, and then you feel like something really hard, like a ball, like right above the pubic bone. And sometimes it's even more down, so you feel the top of the head, but again, it's still hard, and it doesn't move that much because it's a head compared to the butt, which would move more. The last one is the doctor faces the patient's feet and kind of, I think, I think that the Dr. Leo Paul said, let's do a fourth one, but it's not clear what it just confirms everything. Okay. So there's some studies how accurate is a Leopold maneuvers to feel the baby. 95%. Okay, in determining the vertex, meaning that the head is down. That's about it. All that thing about the back, all that thing about the feet, all that thing about a breech being the feet or being frank breech or whatever. So it just tells us if the baby is head down. That's the limit of the test. Okay. Funny thing, 95, like you remember, 95% of babies are head down at term. So are we that good, or it's just like it's meant to be because 95% have babies have the head down. So even if I sat behind my desk and I didn't touch my patient saying, I feel like 95% chances that baby's head's going to be down at term, I would be right. So I don't know, like it shows you it's the same. Okay, so it's not that good. But I've caught a couple of breech babies, so yes, it's a good thing, and I did it with my patients. Once you go home, if your doctor told you, and ask questions. Some doctors are more quiet than others, or some midwives. Okay, is my baby head down? Where's the back? Where's the feet? Can you tell me a little? And they'll tell you what they know. Like I said, sometimes I would confirm with an ultrasound saying, yes, the head is down. The other factor is where we catch the baby's heart, because usually you'll catch it lower, um, uh, almost at the belly button level or under the belly button level, usually on the left side. Like we were saying, most babies have their back on the mummy's left side. So that's another sign that, okay, if the heart's there, you can imagine the heart's in the thoracic cage, the rib cage. So it's here, so that means the baby should be head down. Again, I've seen breech babies. It made no sense. I would catch the heart down, and the baby was frankly breech. So not 100%. Okay, but usually it's accurate. And I've seen like when we deliver twins, if the second twins we cut the heart like way under the rib cage of the mom, we were going, uh-oh, it went breech on us. And sure enough, we would confirm with the ultrasound machine, and it did. So most of the times, if the baby's breech, your doctor's going to catch the heart like almost on the rib cage, way above the belly button. But again, that's not 100%. So once you get home, if your doctor told you your baby is head down and the back is on your right hand side, for argument's sake, try to notice the movement so that way you can spot if your baby changes position. And we're going to talk if your baby's breech in another video. I'll put the links in the description or at the end of this, how to turn a baby that's breech. There's exercises you can do. There's the external cephalic version and all kinds of stuff, but that's beyond the scope of determining your baby's position. I've seen videos of baby mapping, and I was, oh, that's interesting. Sorry, I just kicked my computer. So I was like, oh, that's interesting. What is that about? So basically, somebody was taking pain and basically I was like, okay, how does she map the baby? And she goes, okay, you come from your doctor's appointment or your midwife's appointment. She told you that the head is down and that so you're not like you're just painting your belly. So it should be called baby painting, belly painting, because you're basically, you already know what your doctor told you, so you're not checking it out yourself. But you could have a good idea, especially if you have, like I said, the round ball under the rib, and make sure your doctor or your midwife does check the baby's position. It should be done. Not everybody has access to ultrasound. Not everybody has, it depends on insurances or what have you. So not everybody has a last trimester ultrasound. And if you saw, like some hospital will do an ultrasound at 36 weeks, but if you saw 95% of babies have their head down, so money wise, it's not very worth it. And that's the word I'm looking for, worth it. So it's not really worth it. So not every hospital will, or even birthing center will do an ultrasound at 36 weeks. I've heard of some hospitals doing an ultrasound almost at every visit. That's for overbilling. There's absolutely nothing to see every week. That's overkill. And luckily, ultrasounds are not dangerous, but that's too much. So I'll see you in the next video. Put your comments if you have a nice, a fun story about your baby's position, if it changed at the last minute, if right now you feel the hiccups in your rectum or what have you. Anything about baby's position, put your comments. If you did belly mapping, if there's something I missed, but actually the person said, oh, when you come back from the doctor and you know the baby's position, just paint up your belly. So I don't, it doesn't give you any more information. So see you on the next video. Bye bye.